This morning, global health officials are sounding the alarm once again. Given the scale of the outbreak so far, a suspected 600 cases, health officials now suspect that Ebola started spreading months before the first case was detected. Now, in a press conference this morning, the WHO Director General, Dr. Tedros, said, quote, beyond the confirmed cases, there are almost 600 suspected cases, 139 suspected deaths. And he said, we expect those numbers to keep increasing given the amount of time the virus was circulating before the outbreak was detected. Now, we are also learning a lot more about that American doctor who has already been evacuated from the Democratic Republic of Congo. He was evacuated yesterday, flown to Berlin. Dr. Peter Stafford and the missionary group that he was working with, Serge, believe he contracted Ebola while operating unknowingly on an infected patient. We were able to speak with his colleagues at that organization who said that 2 days after the announcement of the outbreak, Peter began to have some of the nonspecific symptoms that are classic for Ebola: chills, fever, muscle aches, fatigue, and nausea. Now, the DRC is facing its 17th outbreak of Ebola, but it's different this time. It is a more rare strain. It is a different strain that early testing didn't pick up. Back in 2018, 2019, there was a vaccine ready that they could deploy. This time, there is no vaccine. Now, we're also learning from Serge more about Dr. Peter Stafford's family. He was in the DRC with his wife, Rebecca, 4 young children. Rebecca was also a doctor, could have been potentially exposed, and so they are also being transported to the same facility in Berlin where Dr. Peter Stafford is being treated. And there is an additional American physician, Dr. Patrick La Rochelle, who may have been exposed, and they are now evacuating him from the DRC to a facility in Prague. Molly Hunter, NBC News, London.